Is your child not drinking or having fewer wet diapers? I'm Dr. Mona, a board-certified pediatrician and mom, and today we're talking about signs of dehydration in kids, how to manage it, and when to seek medical care. Stick around for key tips on preventing dehydration. Let's get to it. Dehydration occurs when the body is losing more fluids than it's taking in. This can happen from increased volume loss, like sweating on a hot day, or from frequent vomiting or diarrhea. It can also happen from decreased intake of fluids. When kids are sick, for example, it's often a combination of these factors that lead to dehydration. In the medical setting, we assess the severity of dehydration according to mild, moderate, and severe. This is a visual that shows the difference, and I wanted to discuss some key takeaways. In mild dehydration, look at a constellation of symptoms. Thirstier than usual, your child asks for water more frequently. Slightly dry mouth. Their mouth or lips may feel a little dry but not cracked. Normal energy and behavior. Your child still plays and behaves like normal. Skin elasticity. When you pinch their skin, it returns to normal quickly. This is normal skin turgor. Skin turgor is a measure of the skin's elasticity, or how well it returns to its normal shape after being pinched or pulled. Urine output. They may urinate slightly less than usual, but it's still normal. A common scenario is a child who's playing outside on a normal day and forgets to drink water. These are early signs of dehydration that can usually be managed by encouraging them to drink more fluids, like water or an oral rehydration solution. In moderate dehydration, symptoms become more noticeable. Dry mouth and skin. Their mouth is noticeably dry and skin may feel dry to the touch. Sunken eyes or a soft spot. Eyes look a little sunken, or if they're an infant or early toddler years, their soft spot, the fontanelle right here, appears sunken. Less tears. They might not cry as much or have fewer tears. Remember, infants may not cry as they don't have fully developed tear ducts, so extra care should be taken looking at other signs if you are concerned of dehydration in an infant. Decreased energy. Your child may seem more tired, irritable, or less playful than usual. Skin elasticity. Pinching their skin may cause it to stay up for a few seconds before returning to normal, so their skin turgor is decreased. Urine output. They urinate less frequently and the urine can be darker than usual. This can happen if your child has been dealing with a stomach bug that caused several episodes of vomiting and diarrhea over the last 24 hours. They've had trouble keeping fluids down, and despite your efforts to offer water or an electrolyte solution, they may not be drinking as much. In severe dehydration, this becomes an emergency. Very dry mouth and skin. Their mouth feels extremely dry and their skin might feel cool or mottled. Sunken eyes and a soft spot. Their eyes are deeply sunken and the soft spot in babies is very sunken in. No tears. When they cry, no tears are being produced. Very listless or unresponsive. Your child may seem excessively tired, weak, or even unresponsive in some cases. Fast or shallow breathing. Breathing may be quick, shallow, or labored. Urine output. No urination at all or a marked decrease, and urine is very dark. Serious signs. They may have a dry, sticky tongue and show signs of confusion or dizziness. Severe dehydration can occur with some illnesses if severe, or heat-related illnesses like heat stroke, and should be evaluated in ER. If your child shows signs of mild dehydration, you can often manage it at home by encouraging them to drink fluids, which we'll get into. Signs of moderate dehydration warrant a visit to the doctor, where they may be given some medications if they're vomiting, like Zofran, and encourage oral intake or give them IV fluids if necessary. Severe dehydration requires immediate medical attention in an emergency room, where a child will most likely get IV fluids, labs showing their electrolytes, and observation for vital signs. If your child shows signs of mild dehydration or a clinician is advising you on hydrating them at home, here are some tips. To do that for infants, continue to give them breast milk or formula as you would normally do. Do not give water to infants less than 6 months of age, as it can worsen electrolyte abnormalities. If they're older and drink sips of water normally, you can continue to offer that, but breast milk and formula are ideal to rehydrate. If they are dehydrated due to a stomach virus, offer frequent, small volumes of breast milk or formula. Start with 5 ml and slowly increase the volume offered as they show they can keep it down. For more info about managing stomach bugs, check out this YouTube video. If your infant is not able to keep breast milk or formula down, contact your pediatrician about Pedialyte, Enfalite, or another store brand electrolyte solution. These are over-the-counter and usually easily accessible at pharmacies or some grocery stores. They are generally okay to give over 2 months of age, but it's always best to chat with your clinician on guidance to determine if they're actually needed. If your child is over the age of 1, you can continue giving breast milk if they are breastfeeding, or a liquid of choice or an electrolyte solution. The benefit of an electrolyte solution is that it can help replenish electrolytes lost and has the right amount of sugar to restore energy. Vomiting can lead to a loss of sodium, potassium, and chloride, which is why electrolyte solutions are preferred, especially in the setting of a stomach bug. If you don't have an electrolyte solution like Pedialyte, diluted Gatorade 1-to-1 with water or 100% apple juice diluted 1-to-1 with water is an option that actually has been shown in research to prevent the need for IV fluids in moderately dehydrated children. Now, we all know that kids can be stubborn in what they want to eat or drink, especially if they're not feeling well. Popsicles are also a great option for young kids who don't want to drink, but we need to get them hydrated, especially if they have a sore throat, as popsicles can help soothe them. Pedialyte popsicles are an awesome option. You want to avoid popsicles with sorbitol, as this can sometimes cause diarrhea, and we don't want to make things worse. You also don't want to offer tea, undiluted sports drinks, undiluted juice, or soda, as they have too much sugar and can cause stomach aches, jitteriness, or worsening diarrhea as well. With kids who don't want to drink, try to think of ways to make it fun or interesting to them. You can offer it in a silly way, like letting them squirt syringes into their mouth, drink from a spoon or medicine cup, or use a special cup like a mug or a squiggly straw. You can also make it a game, like they have to take a sip every commercial break or every time they hear a certain word in a song. Don't let them guzzle liquids, especially if they have a stomach bug, as this can induce vomiting. Encourage little frequent sips. If they vomit or refuse to drink, take a 15 to 20 minute break and try again. They can eat if they're hungry, but start slowly and make sure their first few bites sit okay before giving a full meal. Hopefully, with frequent small sips of fluids, your child will perk up and their symptoms of mild dehydration will resolve. However, it's important to monitor for worsening dehydration, as sometimes a medical intervention like IV fluids is needed to rehydrate children. If these things are noted, it's important to seek medical attention. Any signs of severe dehydration I mentioned earlier. Still showing signs of dehydration despite encouraging fluids for 3 hours. Your child is under 1 year of age and is only taking in Pedialyte or another electrolyte supplement for 24 hours and not taking breast milk or formula. Your child hasn't progressed to eating food within 3 days, or symptoms don't seem to be improving. Prevention is always better than treatment, and when it comes to dehydration, a little effort can go a long way. Here are some simple ways to keep your kids well hydrated and healthy. Make it a habit to offer your child fluids throughout the day, even when they don't feel thirsty. Water is the best choice for older kids, while infants should continue breastfeeding or formula feeding as usual. Use fun cups, straws, or even ice cubes shaped like stars or animals. This can make drinking water exciting for kids who might otherwise resist. Always have fluids on hand during physical activities or outdoor play. Remind your child to drink before they feel thirsty, especially on hot days where they may lose fluids from sweating. Foods like watermelon, cucumber, oranges, and yogurt can also provide extra hydration, especially for kids who aren't big drinkers. Older kids can learn to recognize signs of thirst and the importance of drinking enough fluids. You can even make it a game by challenging them to drink enough liquids to keep their urine a light, pale yellow color. But remember, even with prevention, illness can happen and dehydration happens, so I hope these tips were helpful to guide you on what to look out for. Has your child ever become dehydrated? What worked for you to get them to drink? And did you need IV fluids? If you found this video helpful, please give it a thumbs up sign, share it because that's how this channel continues to grow, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Comment below with any questions, comments, or personal experiences with dehydration. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.